Hello, my name is Dr. Rory Murphy. I'd like to discuss with you what are the benefits of an anterior cervical disectomy infusion. The good news is the anterior cervical disectomy infusion is a very successful surgery. For people with pain down their arm, numbness and tingling, and weakness, it has a 9 out of 10 chance of improving the sharp pain. Weakness often improves, and numbness generally improves, but not always. The anterior cervical disectomy infusion can be very successful as well at improving neck pain, but it does not always improve the neck pain. What are the risks of an anterior cervical disectomy infusion? Well, there are common risks and uncommon risks that can be serious. Common risks with anterior cervical disectomy infusion include hoarseness, difficulty to swallow, and pain in the neck that can last days or weeks or sometimes be prolonged. Another risk of an anterior cervical disectomy infusion is that the bones do not fuse together. This can occur in approximately 1 in 10 patients. Thankfully, only 5% of people, or 1 in 20, will have symptoms from a non-union. Implants can loosen or fail. This is rare, but slightly more common in people with weak bones from osteoporosis or who use nicotine products. Other risks, which are thankfully very rare but can happen, include damage to structures in the neck, including the recurrent laryngeal nerve, which can lead to hoarseness and a change in the voice, and in serious cases, problems of breathing. Other risks include damage to the esophagus, which can cause severe eating and swallow difficulties, prolonged infection, and may require a prolonged feeding tube. Damage to nerve and spinal cord have been reported, leading to weakness and paralysis and bowel and bladder dysfunction. Again, extremely rare. Other risks include risks from general anesthesia, cardiac risks, stroke, coma, and even possible death. Again, very rare. What are the post-operative pain needs after an anterior cervical disectomy or infusion? Generally, after an anterior cervical disectomy infusion, most people can go home the same day with their pain well controlled. Tylenol, a small amount of a non-steroidal, and a very low dose of opiates for a day or two may be required. But after 48 to 72 hours or 2 or 3 days after surgery, the pain should be well controlled with non-opiates. Most people report that their pain is mostly gone after 7 to 10 days. The anterior cervical disectomy infusion generally in most people does not cause severe pain in the post-operative period, thankfully.